This is a picture of the lower jaw in a dog with a missing first premolar. In this case, you can see the swelling in the area demonstrated by the blue arrow, which is evidence of cystic formation. This is a radiograph of an impacted tooth without a dentigerous cyst. If this is an older patient, the client may elect to radiographically monitor it. If it's a younger patient, however, I generally recommend extraction of the impacted tooth to avoid cystic formation. This is a diagram of an unerupted tooth. This is the gum, this is the tooth, this is the area that's going to become the crown, or the area that you can see, this is the root canal, and this is the enamel forming organ. Dentigerous cysts form from the enamel forming organ of an unerupted tooth. What happens when a tooth erupts into the mouth is that the enamel forming organ is lost after it's laid down the enamel on the tooth. Unfortunately, when it's impacted, this enamel forming organ stays there. When this enamel forming organ stays too long, it may start to create cystic fluid. This cystic fluid will slowly fill up like a water balloon. And it'll get bigger and bigger, and thus causing bone loss. So an early dentigerous cyst will look radiographically like this. In this image, you can see the unerupted tooth as demonstrated by the white arrow. There is a small area of bone loss created by the cyst, which is shown by the red arrow. As you can tell, there's been some moderate bone loss already, but extraction and curettage of the cyst at this point will be a fairly straightforward procedure. Unfortunately, if a cyst is not dealt with early, the cyst will continue to enlarge and will go around the entire tooth. This can result in marked bone weakening, which radiographically will look like this. There is very little bone remaining in this area, and this jaw is at a high risk of a fracture. Therefore, we recommend early diagnosis and treatment of all missing teeth.